Major company alert here. Anthem, Blue Cross, Blue Shield announced, well, we got time limits on anesthesia. Here it is.
Jimothy! Yeah, boss. What on earth is sevoflurane? It's a common medication anesthesiologists use for general anesthesia. Do you have any idea how expensive this is? Yeah, it costs money to keep a patient alive while a surgeon cuts into them. Well, I saw a movie once where a person was given a stick to bite down on while his leg was... Yeah, I'm going to stop you right there. We have to cover general anesthesia. Fine. But I say for how long? What? New rule. If a surgery goes over a designated amount of time, Blue Cross will stop paying for general anesthesia for the rest of the surgery. And who determines how long a surgery should last? I will. You, an insurance executive, will tell an anesthesiologist and surgeon how long a surgery should last. Come on, Jimothy. How hard could it be? Give me a surgery. I'll tell you how long it is. Okay. Kidney transplant. 30 minutes.
Wow. The parody is real. Put it at full mask because this individual is a remarkable human being, a comedian and ophthalmologist. Dr. Glockenflaken isn't the only medical professional calling out Anthem, Blue Cross, Blue Shield. It's a new policy, obviously. It has also led to sharp criticism from the American Society of Anesthesiologists, who warned that the decision could jeopardize patient safety, obviously, increase financial strain on both patients and providers. So the proposed new policy would no longer reimburse anesthesia services for the complete duration of certain surgical procedures, opting instead for a partial coverage model. And the head of the ASA has called it, quote, appalling and, quote, egregious, creating a precarious situation for patients undergoing surgery. Anthem, BCBS, said plans representing Connecticut, New York, and Missouri have unilaterally declared they will no longer pay for anesthesia care if the surgery or procedure goes beyond an arbitrary time limit, regardless of how long the surgical procedure takes, reported the ASA, who has condemned the decision and called on Anthem to reverse this proposal immediately. Meanwhile, TikTokers stand on content best summarize the issue from a patient's perspective. Here it is.
Hey, big dog. Let me get this off you real quick, player. What's happening? Yeah, so your anesthesia time just ran out. They said we can't keep you under unless you come up off some bread. Some bread? How much? About $4,500 for another hour. But I can do a 15-minute extension for about $900. Man, $4,500, I ain't got that. Yeah, man, but you want to set up a payment plan or you want to try to stay awake and hold this flashlight? So what we doing?
Yeah. And, the timing of this whole thing is ironic. Here it is.
Today, y'all released that. Y'all, case you missed it, the internet has been in a bit of a tizzy because a CEO got unalived casually on a New York side street in front of a Hilton. And then hours later, Blue Cross Blue Shield decided today was the time they were going to announce that they were going to stop routine anesthesia for surgeries if the surgery goes longer than the insurance is expected for it to go. You clearly have a case of a targeted attack against the CEO of a health organization. And your response to the world and the country is to not pay for things that you guys have paid for in the past while also increasing premiums for people. Thoughts and claims, thoughts and deductibles, concepts of condolences.
She wasn't the only one who made the link. Here it is. Put him up full mask. One poster tweeted, quote, the United Healthcare assassin, after seeing this, I got one more in me. Another poster would tweet, quote, there's a guy on the city bike with something to say about that. Another reference to the United Healthcare assassin. It's a hell of a thing, right? So let me get out of the land of speculation and let's go to the position that has been presented as fact, because the reality is the facts are damning enough. So the major insurance company that says they give a damn about you, they will not pay for surgery that goes beyond the expected time frame, whatever the hell that may be. What is this about? So now I'm going to jump in speculation. A conversation was had, multiple conversations. Probably told the hospitals, who told the doctors, you're taking too damn long in these surgeries. It's costing a lot of money for this treatment. Because insurance companies are letting you know who actually runs healthcare. By doing this, they are shaping the future care that you will receive. Why? Because the hospital, typically the director is a penny pincher. And that penny pincher will then pinch the doctors. And the doctors will then pinch you because the insurance company pinched first. Who runs medicine? Not hospitals, and unfortunately, not the doctors. Mr. Mayor, hell of a thing. Thoughts?
Yeah, Doc, I think this is they're making an ironclad case to why we should not have insurance companies involved in healthcare, which is why they made the case in this argument right here why we need universal healthcare. This is why when doctors can't worry about what they know they need to do, instead they need to worry about if they're going to get paid for doing what they're doing. That is in fact threatening the patient's lives. This is absolutely disgusting, not just because of the timing, and we saw what happened in New York with the CEO of United, but just because forever it's disgusting to tell doctors that, well, at this point, we're going to cut off this service, even if you say you need it. Because for me, I feel like this is a testing of the water, because now you're saying we're not going to pay for anesthesia past this point. Next is going to be like, well, this surgery, we're not going to pay for this type of surgery beyond this point altogether. So it's a slippery slope that I don't think we should be having a conversation about anyway, being that we're the last developed nation, supposedly developed nation, that does not have universal health care. We have our neighbors to the south that we criticize, like Cuba, that is poor, supposedly, but they've been providing universal health care to all of the citizens of Cuba since the 70s. This is why Black people in Cuba aren't losing their legs and foot to diabetes. This is why Black people in Cuba have longer lives than Black people in America, because of insurance and the role they play in our healthcare. We need to get money. We talk about money out of politics. We need money out of healthcare, and it needs to be universal because it should be a basic right. And people shouldn't have to be worried about what the comedian was joking about, where you be waking up in the middle of surgery and say, we can't go beyond this unless you got money to give us. This is absolutely an attack on poor people, poor tax.
Yeah, and they know there's nobody who would check them. Who's going to check them? The few progressives that would have corporate Democrats took their power away, or at least tried to. The Republicans, please. Nobody is in position to check them. So that was definitely a calculation. We'll bring you updates as they come.